Hello guys, welcome to Anatomy in 10 minutes. Today we will study about scalp. Scalp is not just hair and shampoo ads. It has 5 layers and all 5 are extra. So, intro. What is scalp? Scalp is a layer that covers the vault of our skull. And next we will study about its extent. It extends from anteriorly superior superciliary arc, posteriorly superior knuckle line, and laterally it covers superior temporal line. So superciliary arc, superior temporal line, superior knuckle line. So these are intro and extension. Next we will study layers. So it has, as I said, it has 5 layers. First layer is, we can remember the name of layers by mnemonic scalp itself. First layer is skin. Second layer is connective tissue. Third layer is aponeurosis. Skin, connective tissue, aponeurotic layer. Next loose areolar layer. Next is pericardium, and next bone of cranial. This is bone. So these are the layers of scalp: skin, connective tissue, aponeurotic layer, loose areolar tissue, pericranium. See, here we can see as skin. Skin has lots of hair, lots of sweat glands. Basically, it is high maintenance area. Next, connective tissue. Connective tissue, it's very loyal. It holds arteries so tightly that when you cut scalp, bleeding says, "मैं तो रुकूंगा ही नहीं." So here we can see connective tissues has arteries and veins. Skin has hairs. Next, aponeurotic layer. This layer connects frontalis and occipitalis. Okay, we have muscles. I will show it. We have this frontal muscle and occipital muscles. Aponeurosis connects these muscles. So basically, it connects to muscles. Then loose areolar tissue. This is loose areolar tissue, and next pericranium, and next pericranium. Remember, scalp is simple, only 5 layers, but one wrong layer in exam and marks bleed faster than the scalp. So make sure you remember them correctly by mnemonic scalp. So this text is from Vishram Singh. Skin. The skin of the scalp is thick, hairy, except over the forehead. It is firmly adherent to epicranial aponeurosis by dense connective tissue of superficial fascia, as in palms and soles. Being hairy, it contains maximum number of hair follicle associated with sebaceous gland. As a result, scalp is commonest site of sebaceous cysts. It also contains numerous sweat glands. Next, connective tissue, superficial fascia. The superficial fascia of the scalp is made up of dense fibrous connective tissue that firmly binds skin to underlying occipitofrontalis. Okay, skin to occipitofrontalis and its aponeurosis. Fibrous septa divide this layer into numerous small pockets containing globules of fat. The blood vessels and nerves of the scalp lie in this area. They enter in from below at the periphery. The walls of the vessels are adherent to the fibrous network. Hence, when blood vessels are torn or cut during an injury, they are unable to retract and cause profuse bleeding. The bleeding, however, can be stopped by pressing against the underlying bone. Next, aponeurosis. This layer is formed by occipitofrontalis muscle and its aponeurosis. The occipitofrontalis muscle consists of 4 small bellies, 2 frontal, 2 occipital. Since greater part of this layer is formed by aponeurosis, is called aponeurotic layer. The aponeurosis of occipitofrontalis muscle is so called because aponeurosis of occipitofrontalis muscle is also called epicranial aponeurosis or galea aponeurotica. The wounds of the scalp do not gape unless epicranial aponeurosis is cut transversely. because the aponeurosis is under tension in the anterior posterior by the tone of aponeurosis is under the tension of anterior posterior. So if we cut transversely, then only it will bleed. Loose areolar tissue, as the name indicates, this layer is made up of loose areolar tissue, serves as natural plane of cleavage during craniotomy. This layer is transversed by emissary veins. This loose areolar tissue layer is transversed by emissary veins. Okay. This layer is transversed by emissary veins connecting veins in the second layer of the scalp with intracranial dural venous plexus. Next, pericranium, the fifth layer of the scalp, is formed by the periosteum of bones of whole skull called pericranium. It is loosely attached to the bones and can be easily stripped, but at the sutures it is firmly attached to sutural membrane. Sutures mean where two bones connect, it is called as sutures. At bones it is loosely attached, at sutures it is firmly attached, which in turn attaches it to endocranium. Next, occipitofrontalis muscle. Its origin, insertion, nerve supply, action we will start. So this is Galea aponeurotica. Frontal bellies and occipital bellies. Frontal bellies originate from Galea aponeurotica and insert into the skin of eyebrows and skin of root of the nose, and thereby occipital bellies originate from Galea aponeurotica and insert into this I explained wrong. Occipital bellies originate from superior knuckle line and insert into Galea aponeurotica. Actions, frontal belly actions, they elevate the eyebrows, produces wrinkles on forehead, and next, occipital belly action pulls the scalp backward and stabilizes Galea aponeurotica. Nerve supply, as we can see, frontal bellies, temporal branch of facial nerve, and occipital bellies, posterior auricular branch of facial nerve. Auricle ke behind, so posterior auricular branch, and it is in temporal region, so temporal branch of facial nerve. Next, we will see nerve supply of the scalp. It has two types of nerve, sensory and motor. Sensory are 8, motor are 4. See, sensory nerve, we can see supratrochlear, supraorbital, zygomaticotemporal, auricotemporal, and great auricular, lesser occipital, greater occipital, third occipital, lesser, greater, third, great auricular. GLGT, great auricular, lesser occipital, greater occipital, third occipital. C2, 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 C3, C3. First and last में C3 and this C2, C2, C2 and third, first 3. Next, supratrochlear, supraorbital, zygomaticotemporal, auriculo. This here auricle is there, no? So auriculotemporal. Here, this is temporal ka side. Here near auricle, so auriculotemporal. Here zygomatic bone will be there, so zygomaticotemporal. Orbital will be supraorbital, supratrochlear. These are sensory. See, we can see 1, 2, 3, 4, 5, 6, 7, 8. Next, sensory nerves of scalp in front of auricle, behind the auricle. This table you can read from yourself. What I explained, it is that only. Next, arterial supply of the scalp. Arterial supply same, supratrochlear artery, supraorbital artery, and superficial temporal artery. There, what was the two nerves? Zygomaticotemporal nerve and auriculotemporal nerve. Here, first two arteries are same as the nerve name, but third, we can see third artery, it is superficial temporal artery, posterior auricular artery. These are related to that we studied, no? This muscle. Here it was there, no? temporal branch of facial nerve, posterior auricular branch of facial nerve. Like that only here, superior superficial temporal artery, posterior auricular artery, and occipital artery. Artery supplying the scalp in front of auricle, behind the auricle. Supratrochlear, a branch of ophthalmic artery from internal carotid artery. Supraorbital, branch of ophthalmic artery from internal carotid. Superficial temporal, external carotid. These were internal, this is external. Posterior auricular, branch of external carotid, or occipital, external. So these are internal carotid artery का ophthalmic branch से, and these are external carotid artery का branches. So these three arteries come from external, and two arteries come from internal carotid, these from external carotid artery. Teamwork between two big systems, we can say. Next we will study venous drainage. Venous drainage, the scalp on each side of the midline is drained by 5 veins. The veins of the scalp accompany the arteries and have the similar names. These are supratrochlear, supraorbital vein. They join each other at the medial angle of the eye to form angular vein, which continues downwards as facial vein behind the facial artery. Superficial temporal vein, it descends in front of the tragus to enter the parotid gland, where it joins the maxillary artery to become retromandibular vein, which terminates by dividing into anterior and posterior divisions. The anterior divisions unite with facial, this is posterior, this unites with facial vein to form common facial vein, which drains into internal jugular vein. Posterior auricular vein, posterior auricular vein descends behind the auricle and unites with posterior division of retromandibular vein to form external jugular vein, which drains into subclavian vein. Occipital vein terminates in suboccipital venous plexus. So they are basically telling कि supratrochlear and supraorbital form in medial part of the eye angular vein. Then it continues at facial vein, and this superficial temporal vein, it descends in front of this parotid gland. No, it enters parotid gland from in front of tragus and joins maxillary vein to form retromandibular vein, which has anterior posterior part. Anterior joins facial vein to form common facial and then internal jugular. Posterior joins posterior auricular vein to form external jugular and subclavian vein, and another vein is occipital vein. Next, emissary veins. We have seen that emissary veins connect dural venous plexus, pass through loose areolar tissue. The veins connecting the veins outside the cranium with intracranial dural vein sinus by passing through foramina in cranium called emissary veins. Emissary veins in region of scalp. On each side of the midline in the region of scalp, two sets of emissary veins are encountered: parietal emissary vein, mastoid emissary vein. Parietal, which passes through parietal foramen, superior sagittal, and communicates with superior sagittal sinus. It passes through parietal foramen and it passes parietal emissary vein, mastoid emissary vein. Parietal passes to parietal foramen and it passes to mastoid foramen. It communicates with superior sagittal sinus, it communicates with sigmoid sinus. One will be superior sagittal, another will be inferior sagittal. Connecting them will be this sigmoid sinus. So superior sagittal sinus के साथ कौन करता है? Parietal emissary vein communicate. सिग्मोइड साइनस के साथ मेस्टोइड एमिसरी वेन कम्युनिकेट करता है. Diploic vein, the diploic veins are described in detail in next chapter. So part 2 on applied aspects I will upload in next video. See you in the next video where we again pretend anatomy is easy. Thank you.